Good, good. Good to see you.
Good to see you again, yeah?
Yes, very good.
How is the situation?
Yeah, very good.
How is the situation in Korea?
Huh?
Is getting down?
Getting better, yeah, getting
Just
better.
getting better, yeah.
Yes.
Okay.
คนที่อยู่เกาหลีนี่ชื่ออะไร
Yeah, lucky.
Yes.
Professor Tanchai, how are you? Long time no see.
Yeah, and I think it takes too long. Another long, a long time to see each other, but we can see every day by Zoom.
Oh yeah, of course, yeah.
But we wish to see in Tokyo, right?
Yeah, yeah.
So it's better to say happy birthday to Professor Wutisan.
Thank you very much. Thank you.
Happy birthday, Professor Wutisan Tanchai.
Thank you. It's come up yesterday.
Oh yeah.
Thank you. Yeah.
Belated happy birthday.
Yeah, but
wish you all the best.
Thanks, friend.
이 화면을 볼 수 있나 지금?
Professor Chen, how are you?
Very good. So great to see you here.
Yeah.
Professor Eko.
Yeah. Nice to meet you.
Remember we connect each other through the email a couple of months ago.
Yeah.
Yeah. I hope actually I'm so curious. The conference will postpone for a while, right?
Yeah. So many conference has been postponed for uncertainty time, I think. IAS, APA, IAPA, and so on.
Ah.
Yeah.
I see. Yeah. All right. I received the positive message about the YouTube channel. So right now I can try to open it. So catch you guys later.
So the presentation will be based on alphabetical order.
Yes.
And Indonesia is the first one. Sorry.
So not based on the alphabet order of the name, yeah, but the country.
Yeah.
So Professor Eko is the first, right?
Yeah.
Can I try my share presentation?
Yeah, it's better. Yeah.
Okay, I try, because before we start, yeah. Can you see?
Yes,
Yeah,
good.
Yeah, I can see it here.
Yeah.
Okay, that's good. Okay.
Yeah.
Stop to share. Okay. Yeah. Thank you.
We don't have to start right now. We have to wait for 15 minutes.
Okay. I will present maybe maximum 7 minutes, yeah. So everybody have time.
That's better.
Like in the mosque, that's maximum 7 minutes. It's cool too.
7 minute presentation. Lecture, yeah.
Yeah.
Are you serious, Eko? 7 minutes?
Yeah. Hey, Alex, how are you?
I went to put a coat.
Oh yeah, okay.
I saw Professor he wearing a coat, but I told my
Oh, it's better. I will also take my clothes, yeah. Last moment.
Okay.
Hey, August, 15 minutes? Or
August, 15 minutes is fine?
Yeah, 15 minutes, yeah.
Yeah.
Can I test my slide share, August?
Yeah.
Can I test it now?
Yeah, you can try it.
Okay. So I
야,
just
우리도
do this.
테스트 한번 해볼까?
Can you see it now?
Yes, good.
Yes.
Okay.
Very good.
I will check also mine.
Okay.
Okay. Let me try to check my slide. It's okay?
Okay. Yeah, okay.
Okay.
Oh yeah,
Very
okay.
good. Also, I will try my slide, right?
Nyoba. Nyoba arwahnya tadi.
Alex,
Alright.
you at home?
It's my time. I would like to try. Oh, it's good.
So it's good, huh?
It's good. Yeah,
Okay.
yeah. We can see it.
Okay.
May I try it now?
Sure.
My turn. I try it.
Alex, you look so serious, Alex.
Mr. Vice Minister, we're too serious. How are you?
Good. Okay, it's good.
All right. Thank you.
I miss you so much, Alex.
I
Okay.
miss you too, my friend. I wish we could get together soon.
Yeah, long time no see ya.
I know. But it's really different now, yeah? So different.
Oh, different. You?
Yeah. Huh? Everything.
You look so different.
Working from my house.
Yeah, but you look so serious with tie, yeah?
Should I take it off? Should I take it off? I saw nobody's wearing a tie.
So with no tie.
Okay.
No tie. This is no tie seminar.
I was wearing an aloha shirt.
That's
Yeah.
good. That's better.
Alex, you wear the pants or trousers?
Good point. Are you in your office?
I just wearing sarung.
Sarong, ah. I think Agus wear sarong.
I'm wearing shorts.
I wear sarung, yeah.
Are you at home, Echo?
Yes, I'm home.
Oh, me too.
Yeah,
I was about to go to my office, but my wife told me just to stay home.
yeah.
Alex,
So,
we
are you
don't need tie
walking-
in the
Alex?
seminar.
Huh?
Are you working from home or are you working for home? But it's different, yeah. It is different from and for home.
Friends, do you guys would like to see my side? There are so many students stay in the same room with me right now.
Oh, is
I
that
can
true?
show you a
really?
little bit. Yeah,
Oh,
let me
yeah.
see. Let me see.
Okay.
They are
very
saying hi
good.
to you. They're
Hello.
waving hand to you. Do you see that?
Yeah.
Oh.
I think we should start with alphabet order, but by name, yeah. Alex should be the first.
No, actually, I said
Who will be the first? Agus is first.
Alex
Alex
will be the first
is the
because
first.
hey, Alex,
I know.
you will be the first, Alex. I will give time to you if you want.
No, I suggested you. Come on, please, my friend. In fact, you know why? Because you were absent yesterday during the dry run.
Doing what?
We had the dry run the other day. You were absent.
Oh yeah.
So we said, oh, the one who's absent will be the first.
Yeah.
That's part of the
Alex.
penalty.
Have you been in Los Angeles during
No.
the ASPA?
I wish you know everything, even SEPA,
Yeah.
New York,
ASPA.
everything canceled, huh?
Yeah. The meeting has been cancelled. Yeah.
I was looking forward to the SEPA, you know.
Yeah.
But that's so sad. Maybe next year we can go to SEPA. You were a member of
Okay.
SEPA before, right?
Yeah.
Mm-hmm. Yeah, so maybe next year. So, Agus, you're in Jakarta or you're in
I'm in Jogja.
you're in
Yeah.
Jogja?
Jogja.
Now
Is
in
in
my
UGM?
Huh?
Yeah, in UGM now. Because to make sure the connection, internet connection.
Good.
I thought you were in the civil service. In Jogja. But you're in Jakarta, Echo, yeah?
Yeah, I'm in Jakarta.
But you have no classes also?
Of course. We give lecture from
Yeah, because
Home, yeah.
Jose Chen has class. Yeah, me too.
yeah, because Taiwan has control all pandemic in Taiwan.
We finished all the class last week. So now free.
And you can go shopping ya, Pak Agus ya.
Yeah, right.
Go to the mall ya.
Shopping.
Go to the shopping center.
Also to the movie theater.
Oh. Wayang kulit.
Wayang kulit.
Oh, I think good.
You don't have classes, Professor Gee?
Hmm?
No classes, yeah?
We have a class in online class.
Online class ya.
Oh.
Yes, until mid June.
Mhm.
I'm at my research room. I'm at my room office.
Mhm.
But Jose, your students come to the university, yeah?
Hmm?
No, the
No.
students here today with us is they are all come from different public institutions. They are public servants. They are public
Okay.
servants. Middle middle ranked officials. Yeah.
Okay.
Yeah.
Middle range official, yeah.
Yeah.
I think we should learn from Taiwan and also from Korea, yeah, in how to control COVID pandemic. Yeah.
Yeah, I will mention about that.
Yeah.
For sure. And
I always say to the people in Indonesia, in the normal time, our governance and institution is not able to control and to serve people excellent or in service excellent. And now we are trying to serve the people in the crisis time, in the disaster time. It is not possible, I think.
It's what? It's easier not.
It is not possible, Alex. In the normal time, I think that Philippine government could not control airport.
But now, thank you for reminding me.
You know what I said? I said to Alex,
yeah.
if you cannot manage the airport, you cannot manage the nation, I think.
But now, nobody's in the airport. I know.
Because airport is the door or window of our nation, actually.
Yeah, gateway. You are so right.
Yeah.
Oh. You are so right.
Just kidding, Alex.
Oh my God, it's okay. It's okay.
Please don't take seriously, yeah, because I'm just kidding.
It's okay. This is recorded, so it will be in my. I will use it as a material for my classes.
Yeah,
my good friend from Indonesia, the Vice Minister said.
One agency, one innovation, yeah?
Yeah.
One agency, one university, one agency, one innovation.
You saw that. I copied that from you.
So what is your activities now, Alex? Just giving lecture or other activities in the government?
Yeah, I'm busier now, actually. There's some consultancies.
Okay.
And you? How was your USA decentralization project?
I think there are so many support program for USAID in decentralization topics. Yeah.
But decentralization, how's it?
How is it decentralization?
Yours?
Getting worse.
Really? Remember why?
And especially in the pandemic time.
Corruption? No.
Yeah, corruption is always in Indonesia.
Friend, may I introduce my senior friends? He's Professor Dr. Chaiwat Kamchu. He's a former dean of the political science in Chulalongkorn, and now he acts as a director of the political development in our institute. His interest, and he may do a research on the leadership, role of leadership, especially on the EU and American on this post-COVID.
Okay, good morning.
Good morning. Sorry. Okay.
Good morning.
Good morning, everybody.
Welcome.
Good morning, everybody.
Really nice to see you, all of you. Okay, I look forward to see what you had to say about the subject of discussion today, this morning. Okay. เสียงเข้าเหรอ ครับพี่ขอบคุณครับ
Your birthday.
We have to spray our microphone using the alcohol. You want some?
You are in KPI?
I have also.
Yeah. It's become another equipment.
I have my coffee.
Oh yeah.
I make
we are fasting in Indonesia.
Yeah.
No cafe.
Fasting. But your prayers this afternoon, right?
Yeah, yeah.
Yeah.
이거 녹음하니? 응? 아, 내가 할 때 하려고? 아, 시작하면 하자. 전체 했다가 나중에 편집하면 되니까.
Yang mau masukkan paruan. Oh, bukan. Oh, ini.
Utisan.
Yes.
15 minutes also, each of us, yeah?
Yeah.
1-5.
Can we start right now?
Yeah.
Okay. Thank you very much. Good morning, all speakers.
Good morning.
Professor Alex.
Good morning.
Alex
Good morning.
Wirantes. Professor Kwon Gi-hyun.
Yes, good morning.
Professor Utisan Tansei.
Good morning.
Professor Riko Prasojo. Professor Jose Chen. And
Good morning,
Professor
everyone.
Hidehiko Kanegai. Okay. Good morning, all participants. And I would like to greet everyone, I mean, all the audience participants. Hello, Manila.
Hello.
Can you just raise your hands in the computer? Hello, Jakarta, and also some region in Indonesia. Hello, Seoul, Korea. Hello, Osaka and Tokyo. Hello, Taichung City, Taiwan. Hello, Bangkok in Thailand. Hello, Dili in Timor-Leste.
Oh, Dili.
Yeah. Hello from Phnom Penh in Cambodia.
Oh,
And also hello, Canberra in Australia. So we have many participants coming from various countries. So first of all, I'd like to thank all speakers for participating actively in this international webinar. And today, I would like to discuss a very important issue, COVID-19. As we all know that, let me show the data here. The virus firstly appeared in Wuhan, Hubei Province in China on November 17, 2019. And now the COVID-19 has spread to 213 countries. At the moment, there are more than 3.7 million people infected and more than 250,000 people died. In the US, for example, 1.2 million people infected and 72,000 people died. So this based on data yesterday. So our speaker today would like to focus on what has happened to each country. How many people have been infected in each country, in our region here, Philippines, Thailand, Korea, and so on. And what was the response made by the government to cope with the COVID-19 problem? For example, in terms of budget, reallocation, physical distancing, lockdown, and so on. And how is the governance in each country? For example, central, regional, local government, and also the relationship between local government and also non-government organizations such as the private sector and civil society. And of course, we have many challenges, internal challenges within the government and also in the community. We have problem with human resource capacity, budget limitation, and of course coordination or policy conflict. Of course, if possible, we can make sort of cooperation among countries in Asia. What can be done to solve this problem? And our webinar today is aimed at discussing this issue with public administration academicians. And today we have 6 presenters representing 6 different countries or institutions. Here, Professor Alex Brillantes is professor in the University of the Philippines and also president of AAPA, Asian Association for Public Administration. And then Professor Utisan from King Praja Depok Institute. He is the Secretary General. Number 3 is Professor Kwon Gihyun. He is Professor and Dean of E-Policy and E-Government Institute in Sung Kyung Kwan University. And then we have Professor Eko Prasojo. He is Dean of the Faculty of Administrative Sciences, University of Indonesia, and also the President of Asian Group for Public Administration. And then we have Professor Jose Sen from Tung Hae University. He is also the President of Taiwan Association of School of Public Administration and Affairs. Yeah. The last one is Professor Hidehiko Kanegai. He is from the College of Policy Science and Institute of Disaster Mitigation for Urban Cultural Heritage, Ritsumeikan University in Osaka. And for today, each speaker will have 15 minutes to present, and the presentation will be conducted based on an alphabetical order from Indonesia, and then Japan, Korea, Philippines, Taiwan, and Thailand. For all participants, you can click the Q&A button to raise question to the speaker. And then the moderator will choose question representing different countries. So that's the rule. I think we can start right now. I will give Professor Eko to start first, and you have 15 minutes to share our experiences from Indonesia. Thank you. Yes, please.
Thank you, Professor Agus. Good morning, everybody. I think we are in the same times. This is still morning in Indonesia and also in Philippines. Maybe bit afternoon in Korea. Yeah, okay, distinguished speakers and also participants, thank you very much for inviting me as a speaker to explain about the experience of policy and governance in Indonesia in managing COVID-19. Yeah, it is my pleasure to be here, yeah, to share, and I think this is sharing seminar, yeah, amongst the ASEAN countries, yeah, how to manage the COVID-19 in every countries in ASEAN, yeah. I will explain in 3 sections. One is what policies have been taken in Indonesia by the governments. The second is the problem that we are facing now to manage COVID. And the third section will be how we can look forward, yeah, for the next future to be better in managing pandemic like COVID-19. So I try to present this experience in Indonesia, maybe maximum 50 minutes. And I think we could learn from Taiwan and Korea how they manage COVID better, yeah, and now control all the pandemic better than us. This is the situation, the Indonesian latest official COVID-19 figures. Yeah, so until yesterday, I think the confirmed cases is 12,500 cases, and yeah, the figure is always increasing now. So we still not control effectively the cases in Indonesia, but still the number of percentage between deaths and confirmed cases is under 10, I think under 10%, so between 8 and 9%, yeah, right now, with all policy that we made in two months ago until now in May. Yeah. This is the most priorities Indonesia's policies to manage or to end the COVID-19. So the government decided to have social distancing in wide area, so-called PSBB. So some municipalities and provinces proposed the social distancing project or program, and the central governments review and decide whether this proposal can be implemented or not. So the authority to say that the proposal can be implemented or not is in the central governments. And I also criticize that it makes also longer and also more difficult to take seriously and the soonest program in province and also in the municipalities. As you know, that Indonesia is decentralized governments, that every province and municipalities has their own authorities to decide their own policy. But for the pandemic cases, the central government has the authority to decide and to control the all program that will be implemented in province and also in municipalities. But also the government decide to have to take health prevention policy, yeah, the obligation to use masks and washing and also sanitizers. And now after 2 months, people use masks in a public area, yeah, distance their social and physical, yeah, to avoid the COVID-19. But also I think since 22nd March, the government officially declared that the people should work and study from home. So work and school from home for all sectors. I think University of Indonesia started also in, I think in 22nd March to start working from home and giving lecture through the video conference and so on. Yeah, this is the most policy that we have been taken in Indonesia. Yeah, actually this is not really lockdown. Yeah, as we discussed in the international level, social distancing is only limited lockdown where the people should stay in house, and also if they are going to go outside, they have to use masks and washing and sanitizer, and also maintain the physical distance and social distance. The government has spent 405.1 trillion rupiah to finance the COVID-19. So 1,000 is almost about 15,000 rupiah. So you can calculate by yourselves. So this is the commitment of the government to reallocate the national budget to finance and to fund the management of COVID-19. So 75 trillion to healthcare spendings, 110 trillion for social protections, 71.1 trillion for tax incentive and also credit for enterprise, and for especially for small enterprise and micro enterprise, and also 150 trillion rupiah for economic recovery programs, including credit restructuring and financing for micro, small and medium enterprise. This is the budget side. For the social security network, we have been taken some policy. So we introduced so-called Family Hope Program. So for 10 million beneficiaries family, increase 25% in 12 months. Total budget is 37.4 trillion. So groceries cut for 20 million beneficiaries family in 12 months. Electricity subsidies, yeah. So I don't want to tell the detail. We have also introduced pre-employment card for 5.6 million people as an incentive. So so-called direct cash assistance and fund village for 10 million beneficiaries family. Cash social assistance for non-Jabodetabek. Jabodetabek is metropolitan Jakarta and surrounding the Jakarta, ya. Jakarta, Bogor, Tangerang, Bekasi for 9 million beneficiaries family, and also grocery social assistance for beneficiary family for 1.3 million in Jakarta and 600,000 in Bodetabek. So the government want to make sure that the impacted people can be also survived by giving them the social security network in the various program and also activities. But it is not easy. So in the concept is very clear, but it is not easy as we faced before. In the normal time, that the bureaucracy and the government could not control effectively the implementation of program and activities. And even in the crisis time, like disaster time right now, is very difficult to make sure that all social security network fund can be accepted or received by the people. This is 6 labor policies to mitigate the impact of COVID-19. So maximum protection for labor migrant in Malaysia, because so many people working in Malaysia through delivery of food package. The expanding cash for work, so-called Padat Karya Tunai program in several ministries. So there is a large absorption of labor. Priority for pre-employment card. Registered pre-employment card already reached 8.4 million people, even though the quota this year is only 5.6 million people, and especially for layoff workers is given priority. Yeah. And the economic stimulus only for private companies, business, which commit will not terminate the workers so that they can fulfill their obligation to workers. The government helps also 56 million workers from informal sector by easing tax incentive, social insurance, saving and payment loan, and also several schemes, and also social security network for informal workers. Yeah. 70.5 million informal workers, those categorized as poor and vulnerable groups, must get social assistance from the central and also the local governments. This is 5 scheme of protection and recovery fund for micro, small, and medium enterprise. So the micro, small, and medium enterprise categorized as poor and vulnerable groups become a recipient of social assistance, yeah, for family hopes program, food package, social assistance, village case transfer, electricity subsidies, and also pre-employment card. So the government give also tax incentive for micro, small, and medium enterprise with turnover of below 4.8 billion a year. And also loan relaxation and restructuring for micro, small, and medium enterprise. So the program of delaying installments and interest subsidies was expanded for this enterprise, receiving it from the local governments. And also the obligatories of ministries and state-owned corporation and local governments become buffer for this enterprise, and expansion of working capital financing for 23 million micro, small, and medium enterprise, which are not connected yet with financial institution or bank. The government also released the public finance policy in crisis time of for managing COVID-19. So there are many sub-policies in this government regulation in lieu of X number 1 year 2020, but 3 dominant policies are easing and simplifying of public procurements and also giving the tax incentive for the enterprise and also business. So increasing the budget deficit, yeah, limit exit over 3% of the GDP until the end of I think 2022, not 2020, yeah. So based on our public finance law, that the budget deficit should be not exceed 3% of GDP, but the government regulation in lieu of X number 1 has determined that the deficit limit exit will higher than 3% until 2022. But also this regulation, the government regulation, or giving this discretionary power to the president using the public finance. So by simplifying the mechanism of public finance in the implementations of and managing of the COVID-19. So people criticize this government regulation in lieu of X because this regulation give unlimited power to the president using the public finance. But some are supporting this because the crisis needs more speed to use the public finance to manage the COVID-19. Yeah. Also, the second section will be the problem of government institution in Indonesia managing the COVID-19. So in Indonesia, there are some regulations regarding the disaster and also the pandemic. So at least we have 3 laws and 1 government law. Yeah, the infectious disease law number 4 for 1984. The law non-natural disaster, and also the law of public health emergency and health quarantine. So these different arrangement of regulations and laws make that coordination amongst the ministries getting difficult, because based on the infectious disease, that the ministries in charge is the Ministry of Health, but based on the non-natural disaster law, or disaster law, that the non-government agency for disaster is responsible and in charge for managing and lead the management of crisis. So there are some contradictory and also some problem of coordinations among the ministries and also the government agencies in managing COVID in Indonesia. There are some various institutions involved. And every ministries, like yesterday, the Ministry of Transportation released new policy that actually in contrary with the policy released before. Yeah, so that from today the transportation will be allowed to open the access to the public. Yeah, as you know that Indonesia has a very special Ramadan and Idul Fitri. So people come to from big city to village, so-called mudik. Yeah, this is very debatable policy in Indonesia between amongst the ministries whether we are giving more open to the public transportation, yeah, to transport the people come to the village and to the small cities and so on. But this is the problem that we are facing now. Too much regulation that have been released by the governments, yeah, from March until May, and this coordination, this regulation is not fit or in a streamline amongst the regulations, yeah, to manage the COVID. Yeah, we have also problem the intergovernmental relations problem, yeah, central local governments. So unclear division of authority and administrative affairs to handling COVID-19 according to law, local government and law of the health quarantine. Unclear role of governor as the head of the region and as the representative of the central governments related to the handling COVID-19, especially related to the social distancing, yeah, and national disaster. and also unclear the role of region mayor as the head of autonomous region in organizing affairs ending COVID-19. Some mayor and region are waiting for the national policy to manage the COVID in the local and provincial governments. And how to the budget reallocation related to 2020 state budget, yeah, in the local governments and also the provincial governments to refocusing and to have to finance to fund the COVID-19 in the local governments. So we face also the weak institutional coordinations among the ministries. Yeah, so we propose that the champion of the top handling of COVID outbreak 19 in the last 2 months is unclear and oscillated between Ministry of Health or state government agency of disaster. Yeah, between to these ministries, to these agencies. Yeah. What we are going is also to coordinate better in the provincial and local governments. So the strengthening of governor as representative of central governments to coordinate all ministries in the province and also in the local governments. Yeah. And the distribution of authority between central and provincial local government is not clear due to various laws and regulations. This makes more difficult, yeah, to manage the COVID in local governments. So my last presentation is what's next. So I think the problem of governance is integrated of policy. I think how to integrate various sectoral policy into the one single integrated policy so that they can coordinate better each others, yeah, among the ministries and also between the central, provincial, and also local governments. So I think for this disaster management, the integrated policy is a must. So not only policy, but also we need better coordinated vision and also action among the institutions. So the awareness of the ministers and also head of government agencies that this is not a normal situation, that they should follow the decision has been made by the president as top champion in the managing COVID. And I think the impact of complete pandemic is borderless. So we cannot stop the mobility of people from one country to another countries. That's why I propose that we should collaborate among the Asian countries in creating better policy and also governance, managing the pandemic. But our challenge is how to establish the global governance to overcome world pandemic like COVID-19. So this is actually the challenges of public administrations, public policy, and public management, yeah, to establish more better the governments in the crisis time, in the disaster times. I always say to the people that even in the normal time, we could not control the governments effectively. And now we are facing the difficulties because of disaster and also crisis time, because the government is not ready to serve the people with the disaster or the crisis situation like pandemic now. Yeah. So okay. It's so that the governance reform or administrative reform is getting more priority. It should be more priority in the national development program.
Thank you.
Thank you very much, Pak Agus and our speaker and participants. And this is my our experience from Indonesia.
Okay, thank you very much, Professor Eko. Let's continue to our next presenters. Professor Kaneke from College of Policy Science, Red American University. Time is yours, please. 15 minutes.
Sorry, so I cannot prepare right now. I thought the last person or in sequential order.
Okay.
Sorry.
Okay, maybe Alex, Professor Kon, can you continue?
Yes, I will do that.
Okay, yeah. Okay, thank you. So Professor Kwon is from Sungkyunkwan University in Korea.
Okay, thank you very much. Again, dear distinguished colleagues and all participants, and I'm very glad and honored to present my paper. Thank you again for inviting me as a speaker. Like Professor Echo, my presentation also has three components. In the first part, I will address about the public administration issue and governance issues. And for the second component, I will discuss about Korea's strategic approaches. And at the third part, I will discuss about international cooperation and also some policy implications. So my title goes like Korea's strategic responses to COVID-19 crisis. The subtitle goes like network governance, digital capacities, and its international implications. First, I'd like to talk about Korean government response system from the perspective of public administration. As you know, as of February 23rd, at the highest alert level, Korean government set up Central Disaster and Safety Countermeasure Headquarters. This is CDSCHQ. From the early first start, headed by the Prime Minister to effectively fight against this crisis. At the same time, local government, each local government set up the local countermeasure headquarters to secure specialized hospitals and beds. So our public administration organizational structure or headquarters is two-part, central and local government. It will be similar in the Indonesia maybe. And the Prime Minister has two components. One is Ministry of Health and Welfare. The other one is Ministry of Interior and Safety. This is Home Affairs. And also ours also 226 local government has a task force. So it has a cooperative network from the early start. So manpower is like more 1,196 core manpower at the central, and also many local and volunteer at the district side. And for the budget, basically Ministry of Health is 82 trillion won, and plus additional imperative budget is confirmed is more than 3 trillion as of March 18th. And the other one is that network governance and governance cooperation. So first one is organizational cooperation within government. Obviously, there is some miscoordination at some point, but overall speaking, Korean Controlling Disease Center, CDC, has a close cooperation with police system and also Ministry of Land and Infrastructure and Ministry of Science and ICT, set up a new management system using system user and also movement path of confirmed cases. So this is a GIS system, so that accurately tracing whereabouts of the confirmed patient and then open the data to the public in a real time. And second one is that voluntary action from civil society. More than 3,000 medical practitioners have volunteered in helping Daegu City. This is one of the most dangerous cities since the first outbreak of COVID-19 in Korea. And also continuous donations have come from private enterprises, institutions, and citizens. Finally, public-private cooperation putting over $100 million, Korean CDC made a research fund to develop new vaccines or other medical responses. And stronger measures and control to fight against this COVID effectively, Korean government imposed a mandatory 14 days quarantine on all the passengers arriving from abroad as of April 1st. And April 13th, all inbound passengers arriving from the United States are placed under self-quarantine and must take confirmed test within 3 days. This is compulsory. At the same time, notably, Korean government providing all the free tests to the foreigners, even though it is illegal stay. If they feel some symptoms, Korean government encouraged to call the number 1996. There is no other number. So this is no forced departure. So this is another characteristic. So you can see central governance system and local governance system using symptomatic cases and non-symptomatic cases. Now, I like to talk about some smart technology and infrastructure. As you see, Korea was kind of famous about smart test kits. This can consume, can test at least more than 20,000 confirmed patients daily. So this test capacity is keep increasing in Korea. So if you see 64,000 is test performed and test concluded is 63. So it is positivity rate is 1.7%. But if you compare with Japan, positivity rate is 8.2%. So this is a little bit comparative perspective. And also driving through and also work through this kind of smart technology and system and help to the Korean situation. And currently, as of today, maybe confirmed cases still in Korea is more than 10,000, and deceased people is 253. Okay, but if you see the comparatively, as mentioned, August, USA is deceased person is more than 66,000. And also confirmed patients is more than 1,013,000. And here in Philippines is 8,007. In Indonesia is 10,000. In Korea is similar, 10,000. And Japan is 15,000. Of course, China is 82,000. And also, as you know well, Spain, Italy, and Germany, France, they have very high fatality rate. So as of from the April 30, Korea could relatively well to maintaining less than 10 confirmed cases. From the April 30th, is confirmed cases turned to zero, and there is no additional dead person, something like that. So quickly stabilizing, more or less. So the Korean current situation, as you see, quickly stabilizing, and also if you see the dead people, there is for the last 2 and 3 weeks less than 8. And for the last 1 week or so, its becomes zero. So if you see the more clear picture, obviously, as of March 1st, there is normal shape distribution. At the severe situation, we have 909 infected cases. But from the April 1st, Korean situation is quickly stabilizing. And as I said to you, in the recent 1 week, it's more or less 1 or 0, or something like that. But I am so worrying about that. From yesterday, Korean government changed the strict social distancing policy to so-called life distancing policy. So it's a little bit loosened. So I would worry a little bit about it, but I think at the same time, even though we accept this deregulation a little bit, we also should keep self-distancing in our daily life with our own will and commitment. If you see the fatality rate, France is 18%, Belgium, UK, Italy, Spain, all above 10%. Korean fatality rate is 2.3%, is second lowest in the world, maybe second or third. So Taiwan and Hong Kong and Russia is doing okay about these issues. And I briefly want to mention about foreign press loud Korean performance. I don't want to spend a lot of time about this because this is a serious juncture. I don't want to talk big, but the BBC said that coronavirus in Korea, how trace, test, and treat may be saving lives. And also the diplomat in Korea, the answers to these questions are provided by the government daily through press briefings, website, and automated text messages, which tirelessly communicate the recent locations traveled by new diagnosed patient. And Washington Post recently says that Korea's impressive management of coronavirus only strengthens its rapidly growing cultural influence around the world. Now, I like a semi-conclusion, I want to get some lessons and conclude with these 3 key items. First, my analysis says that first point is in Korean case, strong control tower of KCDC.
Professor Kwon, could you make your slide presentation?
Sorry?
Show slide presentation. So,
a little bit bigger?
Yeah, bigger.
Okay.
Slideshow.
Okay, sorry.
Okay, that's good.
Sorry about that. Okay, the first point is that strong control tower, KCDC, enabled to control the related agencies. This was initiated by the lessons of MERS 2015. As Professor Eko mentioned, maybe some difference between Korea and Indonesia is that in Korea, we have a severe lessons from the MERS in 2015. Taiwan is the similar case, I think. Taiwan also built often based on SARS in 2003. Of course, our professor will mention it later more accurately and specifically. So Japan, Nihon Gejai newspaper, very famous newspaper, expressed that what Korea has, but what Japan has not, is this kind of a controlling system based on new legislation from the lessons from MERS in 2015. This legislation empower very strong empowerment to the KCDC to open the data, even though there is some privacy issues, for the benefit of the greater common good. KCDC can be cooperating with police office to trace and tracing and track down all the issues and whereabouts. And also Hong Kong newspaper says that the Korean situation is the power of the citizen and also nationwide relatively very cheap rate of national insurance system. This lowered the hurdles of hospital and allowed a widespread medical coverage. Finally, but not leastly, is smart infrastructure and smart governance means that innovative smart system such as drive-through and work-through and smart kits. Second, using big data and transparently open and allowing to tracing patient whereabouts, as I mentioned. So in conclusion, Korean government built upon its strategies based on the policy lessons of previous experience of SARS in 2003 and MERS in 2015. So as I mentioned, obviously, we still, in Korea, government still have to be very careful because pandemic is still going on and we never know when the second wave might outbreak again. So Singapore is the case. Singapore is only the very best case, but sharply increasing confirmed cases from the April 51, more than 10,000. Hong Kong and Taiwan and tightly keep social distancing guidelines, showing the best practice, I believe. And as shortly, I'm going into my final segment of my presentation. I want to mention about global pandemic and serious concerns. As mentioned by the Professor Agus, we are approaching about more than 258,000 dead and more than 3.72 million infected. So global pandemic and outbreak of first wave. Worse yet, the medical expert, warnings that fall this autumn outbreak, maybe, if any, might be much harsher than this spring break. So WHO should expedite to develop new vaccine and also new medicine and medical system. So this is the recent, data in the worldwide, as I mentioned. Okay. As a second chief, WHO is worrying about especially African continent. If you see the picture, currently very slow and confirmed cases is only more than 16,000. But because of, as you know, the weak medical capacities, if it ignited, it will be exploded. One good news though, international cooperation of EU and Korea and Japan and China was very successful together, already more than 10 trillion won for vaccine investment. It was yesterday's news. An online project is within 3 hours. It was successful. This case should be a valuable lesson for the Asian regional cooperation, I believe. So we need a strong cooperation in any way. Also, we need to set up the rule and principles and formulations how to distribute this medicine or vaccines, if any, globally. This is our, issues.
Okay.
So my final conclusion is effective policy capacity is the must and key. So in conclusion, Korean's case was 3, KCDC strong tower and nationwide insurance system, smart infrastructure. So in brief, we need an agile manufacturing system or a governance with an effective policy capacities. And finally, each country should, the lesson is responsible governance. And this is drive-through case in Indonesia. My final note is that even at these critical times, we need to wake up to watch the banality of evil, temptation of totalitarianism or populism, as Yuval Harari or Hannah Arendt or Timothy Snyder at Yale University has warned, using a terror psychology of the people as the ruling techniques will be the seduction of the tyranny. This is maybe a little bit out of context, maybe you believe at this moment, but this is another serious point we should be watching out even after this crisis. Thank you very much.
Thank you very much, Professor Kwon. I don't want to give comment, but just let's jump to Philippines. Please, Professor Alex.
Thank you very much, Dr. Agus. Is the slide share on?
Yes.
Okay. Thank you very much. There. Well, yeah. I will speak 15 minutes, and I'd like to thank my young colleagues, actually, Aina from the Development Academy of the Philippines, Carl from the University of the Philippines, and Pia, a friend who's studying in Belgium right now. But thank you, Dr. Agus, thank you, Dr. Echo, and Dr. Kalina of the PSPA for this opportunity to be part of this important event. We have many students who are also participating here. I'm sorry, can I just, there. So I already expressed my gratitude and my presentation is about 6 components: the state of the pandemic in the Philippines. And then I'll also talk about the government response, because government has somehow responded to this at the national and local level. Then I'll talk about specific cases of local governments. And then equally important, what are the issues and concerns, as my colleagues have discussed, and ongoing lessons learned. This is the map, and of course, you've already discussed this, Dr. Agus, and so has Professor V. And the Philippines, as you pointed out, is second to Indonesia. We have somehow about 13,000 cases. I just want to remove this, okay. 13,000 cases. Yeah. And just today, as of May 6, we have 10,000 cases and 658 deaths. So the question now is, just yesterday, one of our doctors, Dr. John Wong, an epidemiologist, said that we might have already flattened the curve. That's good news. But at the same time, I think it is important, as our 2 earlier speakers mentioned, and so did Dr. Gee, mentioned that, we should really not be complacent. While we may not be out of the woods, there have been reports that we might have flattened the curve, but equally important, we should not be complacent, as pointed out. And I'll talk about that in a while. But our government, through our president, has continuously addressed our nation. So was our vice president, and so was our cabinet spokesman on the right side or to the left side of your screen. So of our Undersecretary for Health, Undersecretary Berhere, Deputy Minister, and also our Secretary for Local Government. The point is, our government has been very visible, I think. And I think that's very, very important in terms of crisis. We've talked about the so-called whole of government approach. And it is so true that this pandemic really affects all of us. And this has somehow brought the different local governments coming together. That's why earlier, even the artists, even the and other sectors, we talk about this theme that we heal as one. And that's also the theme of our budget, healing as one. Point being that it should be a whole of government approach, and equally important, the executive, legislative, and local governments have been part of it. And as I would suggest earlier, even the judiciary has come in. Can you hear me? Are we okay, Agus? Hello? Agus?
Yeah.
Okay, sorry. So, sorry, whole of society approach. And just the other day, we had a webinar again with our deputy minister, and she mentioned the framework, if you may, that our approach is national government enables it, the local government leads it, but it is people-centered, people-centered. So you have now here, since we are all in public administration here, we talk about the different roles of the different sectors. National government enables, local government leads, it is people-centered. This slide just shows the different, highlights in a longer slide that I have, which I can share with you. But for the purpose of this, I'm just highlighting here the major activities, if you may, that the government did, including, when the president addressed the nation. The president has addressed the nation more than 7 times about this. Our interagency task force has met more than 13 times. It is interagency, it includes the different ministries, health, education, communication, etc. They've been meeting very, very actively. And the last part, we talk about some of the issues, and even the Supreme Court has come in recently because they released an administrative order that stipulates reduced bail, bail for those who comes with 12 to 20 years in prison, releasing them. Because as you might know, our jails are very congested. So the Supreme Court has come in to see, and for humane reasons, among other things, of course, to see if our congested jails might be decongested by releasing the prisoners. Okay. So I guess what I'm saying here is, since we're in public administration government, the role of government agencies, we have the interagency task force, Department of Health, as I mentioned, Interior and Local Government, Trade and Industry, Agriculture, Tourism, Education, Social Welfare, Finance, Budget and Management, the Planning Authority, Defense, Justice, Information. They have been meeting as one very, very regularly. Okay. And recently, as part of this, I guess Dr. Eck also mentioned, we passed a law. It's called the Bayanihan Heal as One Act in March 24. And the government allocated about 275 billion pesos on the emergency fund, 275 billion pesos. And the law provides, among others, defining the relationship between national and local governments. And there's an interesting point that says that local governments are still allowed to exercise their autonomy. Okay? Then this is very important. It allocated amounts to up to 5,000 pesos to 8,000 pesos a month in emergency aid, depending on prevailing minimum wage. Point, government providing social amelioration to those who may need it. Third, this hits many of us in government, if you may, since it is really reallocation of the budget. So some national government agencies, since the crisis was unforeseen, there have been budget cuts of some national government agencies. So the Heal as One the law provided the discontinuance of some programs, no? And each government agency has been asked to set aside some amount for this Heal as One budget, Bayanihan Heal as One's budget. Regulation, they talk about the importance of regulation, regulating traffic on roads, and all of us are now in lockdown, although we don't call it lockdown, we call it expanded community quarantine. No? And then a governance issue, you and I know that filing of taxes and submission of fees, etc., these have all been postponed. As a matter of fact, I just received a SMS right now that said that they will not, the extension of my payment for the GSIS, our government service, has been postponed. So in one sense, the government has somehow took cognizance of the crisis and somehow postponed many things as far as payments are concerned, etc. And the governance issue, accountability and transparency through reporting. As I mentioned, the president has addressed the nation a number of times. These are some of the decisions of the interagency task force. Since I don't have much time, it's in my longer PowerPoint that I can share with you, prepared with my junior colleagues. The travel bans have been decided. And then the repatriation of workers. We have very many overseas workers. So many of our workers have been repatriated, but they also decided already on who can go out, outbound workers to these countries, no? To Hong Kong, to Korea, etc. Then the community quarantine, we have been now at ECQ, we call this expanded community quarantine, and it might be lifted, by the 15th, and it might be general community quarantine. It's a little laxer. But the point is, these are all done by our interagency task force, and this is all based on studies and science through the NCOP trackers, work from home arrangements, social amelioration, I mentioned that already, and of course, a price control, which can be paid. In this second part, I'll be done soon. In the second part, so first part, I talk about national government. I talk about the different interagency arrangements. But at the end of the day, it is local governments. As pointed out by our Deputy Minister, local government led. I'll just point out 4 local governments and I'll be done. What have our local governments done? I decided to choose Metro Manila because half of the cases are here in Metro Manila. Half of those 10,000 cases that we have had, it's here in Metro Manila. Because of, among other things, I guess, congestion, because of, among other things, available information. But I'll just talk to you about some of the cases that some of our local governments have done. Marikina, it's a local government. The key to their relatively success is early response. And they talk about the importance of public awareness. They use the money for procurement of testing kits, provided free transportation, and reprieve tax penalties for Marikina taxpayers. Okay, so that's the local government doing it. But this is very interesting because even before the national government authorized it to set up a testing center, the local government of Marikina went ahead and set up its testing center. There was a little dynamic between the national government, Department of Health, and the local government when it came to these testing centers, but it has already been settled. But the point here is you have a local government that on its own responded to the need for testing centers. And they have already met the criteria of the Department of Health. Another local government is Pasig. Pasig City, they continue to do daily disinfection. In my longer slide, I have some statistics of how many infections, how many cases, but of course I don't have that much time. So I decided to shorten it. Pasig City continues to do a lot of daily disinfection in public areas and distribution of disinfection kits to the barangays, to the villages. But what's interesting in Pasig City is they use drones, disinfection drones, to help curb the spread of COVID-19. Equally important, Pasig itself being quite an innovative local government, has been providing electric bikes to the people because right now we don't have public transportation. It has been banned. So they have on their own provided bikes for people to do their important needs. Equally important, and we have a number of local governments that have done this, social amelioration. On their own, the local governments have gone out because people have a hard time purchasing food, basic items. So they introduced what they call the mobile market, and they have food coupons for public students, the mobile market that goes around. Even here in my own barangay, we have a mobile market. And as I mentioned already, they do also have the testing kits. But this is interesting because they have partnered with a local hospital, the medical city activation testing booth. My point here is that the governance concern here is partnership between the local government and the available resources. It might be the hospital, it might be the school. I'll mention that in a while, but Pasig City has done this and they talk about social distancing. Well, these are some things that have been done. If you look at that interesting slide, they do this for your safety, keep your distance. No? Another city is Valenzuela. They passed an ordinance on anti-hoarding, anti-panic buying, again, market on wheels. And of course, they did a lot of testing, wear your mask, similar to encouraging the citizens to change their behavior. This is important for Valenzuela because we have some OFWs, overseas Filipino workers. So when they come home, they are given testing by the local government. So when you come home, you undergo mandatory quarantine and get tested. And this is done by a local government on their own. Of course, with the technical assistance and advice of the experts at the national level, but equally important, initiated by the local government. Remember what we said earlier, philosophy is local government led. Finally, another case is in Baguio City, up in the north, in the mountains. There's not much cases there, but what is highlighted here is really, apart from the very disciplined population, really amazing. Because organized social distancing, they have a very good mayor there. He used to be a general, but very, very good mayor. And for me, this is one case where leadership is very, very important. This is what they call Mayor Magalong of Baguio City. In this case said, well, I won't open the schools unless it is safe for everyone. So strict mayor with political will. I'll discuss that in a while. Another city is Taguig. Dr. Gee, you are the expert in e-governance. Among others, they talk about drive-through testing, community-based testing, and the role of public hospitals. Taguig, another city here in Metro Manila. This is, they did some, you can do some drive-through testing in the BGC, that's the Boniface.
15 minutes, right?
How many more minutes, my friend?
Actually, already 15. Yeah, okay.
Oh, okay, I'm done. Okay,
Yeah.
so I'm sorry. So give me 2 more minutes, okay? Makati City, I apologize. So let me go now to the issues and concerns. Interagency coordination is important. Policy conflict, there are some. In fact, at one point, our Secretary of Planning resigned, but that's all part of the dynamic here. Local government capacities, the congestion in our jails, etc. So what are we learning? 3 minutes, 2 minutes. What are we learning? One, intergovernmental cooperation is important. Vertical and horizontal is important. Local governments are frontliners, and continuous capacity building in disaster preparedness. Number two, never forget the question, for whom? People-centered, as pointed out, providing access, hence the mobile markets, enable, and the third is maximize partnerships in business, civil society, and the community. And what are we learning? Leadership is key. I just read something that said earlier that the best antidote to COVID-19 is leadership, but we've been talking about this for the longest time. We've talked about the importance of what we have called phronetic leaders. Finally, the importance of adjusting to the so-called new normal. How do we change our behavior? How do we change after this? We need to continue to practice new behaviors, physical distancing, wearing masks, etc., frequent hand washing, and proper. So really, how we change our behaviors as individuals. Because at the end of the day, trust in institutions is the key. Let me end by sharing this framework. We've talked about this, that we can change structures, but equally important, we, the citizens, have to get involved, and our values have to change our behavior, but equally important, leadership does really matter. And I look forward to learning from you, our friends. Terima kasih, thank you, kopun makap, domo arigato, kamsahamnida, xie. Maraming salamat, my friends. Thank you very much.
Thank you, Professor Alex from UB. Let's go to Professor Jose Chen from Hubei University. Time is yours. It's 15 minutes, yeah.
Okay. First of all, I would like to confirm. Can you see my share the screen?
Yeah.
Yes.
Thank you very much. And then I would like to appreciate this invitation. It's a wonderful platform, and I'm so lucky already to hear the best sharing from the Indonesia and South Korea and Philippines. And right now, I would like to add some my observed experience of Taiwan to enhance our better understanding about the COVID-19 pandemic around the world. So I think as you know, from my topic, I try to apply the crisis management to carry out my presentation today. So let me see. Okay. Oh yeah. Okay. So I will try to divide it, my presentation into 3 sections. First one is about the mitigation and the preparedness, and then is the response and the stage of the recovery. So I think that right now most of our experience will be in the stage of the mitigation and preparedness, and also the response. For the recovery, I was thinking about it will be a better. It is kind of good example to explain my idea about the regional collaboration, looking to the future. Okay, so let me go to my first part about the mitigation and preparedness. I think I try to make a conclusion from the diverse countries' experience. I think the regulation or the policy about the contact tracing, limiting travel, quarantining citizens and also try to cancel large gathering event. That is the common, very common policy applied by the different countries around the world. One of the most important things I think can help us to mitigate the impact of the COVID-19 is about the policy of the social distancing. I think that this policy brings a huge influence to our performance to prevent the pandemic. So this is one major observation from the different countries' policy. So let's go to this time schedule. So in Taiwan, as you might be realized, that Taiwan is one of the countries realize the threats of the COVID-19. So in the end of the last year, around like December 31st, we have an early detection about the mystery of the COVID-19. So we try to send out the information to ask the WHO provide more information. Of course, that is not get the official response, and seems that WHO didn't take it seriously. But we didn't stop our actions. So without any partner to go to forward with us, we began in Taiwan. We began our preparedness about how to prevent the COVID-19. So on January 2nd, the CDC Taiwan, they already set up a team, try to collect more information about the mystery pandemic of the COVID-19. After that, we, according to our domestic act, actually we have a act try to divide this kind of threatened disease, divided them into like a 3 level. So in the middle of January, the COVID-19 already categorized into the level 3. So the level 3 already is a kind of important, it's kind of a big issue already in the public health, in the domain of public health. So we set up the CECC, so-called Central Epidemic Command Center. It will become a authority center, try to integrate resource across the different administrations. Not only for the medical department, also for the private sector, and also for the other sectors. So all the country already, the government already try to mobilize all the different resources for the disease prevention. I have to say at that stage, at that time, most I believe a very high percentage citizens in Taiwan, they probably not satisfied with the strong regulatory strategy or action done by the government. But the voice from the civil society, from those self-organized organizations, they play a very important roles, because they keep voice out to remind, to persuade all the citizens to work together, although you might be not quite agree with the strong regulations. So after that, keep forward to the January 23rd. At that time, the CECC already adjust the COVID-19 pandemic to the level 2. So at this time, the Ministry of the Health and the Welfare, he will become the competent authority. So we try to adjust the competent authority higher and higher. So let's go to the February 27th. At that time, it already become level 1 disease. So we try to change the leadership. According to Alex sharing, he mentioned about the leadership is one of the most important elements about COVID-19. I'm personally quite agree with Alex argument. So because for example, in February 2027, we already adjust the competent authority goes to the cabinet. So Premier, he played a very important role at that time. This is about a division and structure about COVID-19 task force in Taiwan. So you can see in the bottom, in the orange color, we have the epidemic intelligence group, which played a very important, which provide very important support to the medical professional domain. Also, the border control is important. The community border health response. As you know, the healthcare insurance and the system running quite well in Taiwan. So the medical cost to individual citizens are always affordable. So people, they have a willing to, and also have a good access to the medical service. I think this is also one important. And by this point, I think we share the same experience compared to South Korea, because in our friend professor, he mentioned about the insurance system play a very important role. So I think in Taiwan's experience, this is also important. And the third part is about the logistics section. So the resource coordination and the research and development. For example, we have so many so-called gango, government support and non-government gango. Some of the gango institution, they try to do the medical research, try to bring cutting edge testing tools, which is also a very important factor. The other one is some team, they are focused to do the research about the cure of the COVID-19. So I think they are something going forward at the same time. And most of the logistics section right now, they might be hadn't gained enough visibility to the social, to the media, to the ordinary person, citizens. But as I know, they play a very important roles in Taiwan, especially for the following stage about the recovery. Okay, going to the next slide, I would like to share is this is about the website about the CDC in Taiwan. By introducing the CDC website to all our online friends and our distinguished presenter, my purpose is to try to bring the issue about transparency and openness. Also in I think also in Indonesia and Philippines and South Korea, mention about the transparency and the data sharing is important. So in Taiwan, the transparency and the openness government already very highlight policy in the past decade. So right now, when we deal with the disease prevention issue, it's quite normal to our government keep the information open, keep the information float, and share by the different group. So I think this is also very important things in Taiwan, because by this way, not yep. I'm sorry?
2 minutes maybe.
Okay. Oh, thank you. So by this way, more civil society, they can get the information and do their voluntary service, which are helpful to the the COVID-19 control. So in the stage of the response, we do a lot of things. Like here in this slide, you can see some strategies done by the CDC. So border control is a quite important thing, and the community transmission control, that is important. And I think the medical supply is one of the key for a better prevention. The medical mask is totally regulated by the government in the early stage. Of course, which can bring some dissatisfaction to the government. But from right now, let's go look back to the past months. I think the medical supply control and regulate is an important factor for the better prevention and disease control. And also put in the legislation, all the government strategy in Taiwan, they need some legal support. So we have some act already exist. For example, the Communicable Disease Control Act, which is one important thing. And the Disaster Prevention and Protection Act already exists, which is also important. But one new special act, which is also equal to the experience from the Philippines, mentioned by the Professor Alex. In Taiwan, the special act is about the relief and the revitalization measures for the fever, pneumonia with the Nova pathogen, which was passed in February 2025. So it is also important. By this way, the government can mobilize the public budget. They can bring the more supportive subsidies to the enterprise, to the individuals, citizens. So legal support, legal base is an important factor in Taiwan, and that's the reason why we have to pass a special act. In the stage about the recovery, I think I will shorten my presentation. I only want to share something about my observation, which might become an important issue in the stage of the recovery. I think in the mitigation stage and the response stage, how to respond very efficiently to control the disease is become a very important thing to the government. So the regulatory policy and the administration will become the main themes at that time. But you know, people always thinking about is that how to make a balance about the power and the people right. So I think in the future, when we're thinking about what we should do in the stage of a recovery, I think the review about the regulation, the power utilized by the government will become a main thing in the future. So they were related to some of the human rights issues also, because for example, subsidized policy in Taiwan is so common, goes to a different group. But some group, for example, the special business like a nightclub or something, their business has been stopped very early by the government. But there are no policy mentioned about how to give them the subsidy. Okay, but let's go back to the human rights discussion. There should be no difference. There should be no difference among different worker in different business industry. So this is just a show example. But recently, right now, we have a more strong subsidy policy goes to some unemployment population. Or maybe I should say people is not in a stable employment status, who also can have the opportunity to get the subsidy from the government. But the application process bring a very huge dissatisfaction in Taiwan right now, because the politicians, they announce the policy very rapidly, and in their sharing, they think that it's very easy to get this kind of subsidy. For example, bring your ID card goes to the government officials' windows, then you can get a subsidy. But to be honest, by the rule of laws, the civil servants, they have to always follow so many laws. So when the individual person goes to the front line, first line service asking for the subsidy, there are so many conflicts in the on site. So I would like to take this as an example to emphasize the important things about the COVID-19 prevention. We have to not only focus on the efficiency. The coordination is so important, but the coordination is not only among the agency. Another coordination issue is about the individual. By individual, I am talking about leaders, politicians, individuals, individual civil servants. So how to make them have a better understanding about the rule of law and the process about the administration, which are the huge challenge in the recovery stage in the future. So that's my idea about that. For the regional coordination in the future, of course, I think in Taiwan's cases, how can that special experiences like Taiwan experience can share by the regional countries, which are of course very helpful to the disease prevention in the future. So I think the regional cooperation, which is thinking about how to get rid of the politician issues and thinking about the medical issue, the disease prevention issue. By this way, how to establish a good information flow and the shared system, which is very helpful to the regional cooperation in the future. And also from the Taiwan experience, I would like to say that's 100% sure. You know, some people, some countries' experience is very helpful to the regional pandemic control. So that's why I would like to say as a conclusion about my idea about in the future stage about regional cooperations. That's my presentations. I think I run out my time, but I would like to share forward forward my special appreciation to my PhD student who helped me to organize this. Okay, thank you very much.
Thank you, Professor Jose Sen. Let's go to Professor Witisan from King Prajadeepak Institute.
Okay.
Thailand.
Yeah, thank you very much for everyone. And first of all, I would like to thank Gus to set up this program. And I have to express that I'm not a professional in medical care, but we are talking about the what is going on in our Thailand. Can you share my slide? Okay, could you see my slide?
Okay, yes.
Okay.
Very good.
First of all, my slide will cover the current situation and our strategies and what we have learned. Even we are talking about what we have learned, I think it's too early to be conclude success or failure of the case. Because COVID-19, the battle is going on and we don't know yet the second wave will happen or not in Thailand. Especially the decision-making on the government are under the circumstances of the dynamics and uncertainty. So what we should learn is we should learn from day to day, and we have to accumulate our knowledge to make a conclusion after the end of the COVID-19. And we don't know yet when and how we end the COVID-19 and how many to sacrifice and how much to spend for the COVID-19. This is my preliminary session. Based on our statistic, the situation as of the 5th of May, only new, we have total of the 2,988 case. We have 32%, around 2,700 has recovered. We have so far, as is the yesterday 7 p.m., one more dying. So 55 died, and less than 200 are receiving the treatment. So the 2,700 already recovered and back home. So our situation seems to be going down. I mean, the infectious. That's why the government tried to release our treatment many area. After the 3rd May, the government already have a guidelines to relax the restriction. But we still have the key measurements, that cleaning, washing, wearing masks, providing physical distance, and limit number of people to gathering. An additional matter that we are emphasizing is we have a temperature screening that we start at the beginning, and we also will be randomly check to the many agencies that we are already put them as a white business. So due to the reducing case, we are allowed the consumption of alcohol now, but you have to drink at home. We have the governor provincial have authority to set the restriction. The travel between province should be avoided, but if you cannot avoid, you have to be checked. And now restaurant, food outlet in the shopping mall can be open, but only take home service. And the most important is the barber shop already open. So now I have a good haircut yesterday. If you look at the stage, we start with the first in the 3rd of Jan. We are opening the screening of the case in Thailand. And we have in the 4th of Jan, we have our first operation of emergency operating center that under the Ministry of Health. Why I mention this? Because I will emphasize on that. And on the 5th, we has already prepared the screening at Suvarnabhumi airport. Because of the incidents happened in the China, and you may know that in Thailand, the majority of the tourists in Thailand is come from mainland China. So we start to screening. And on the Jan 13, we are first found a patient who is a Chinese in Thailand. And after that, in the March 1st, so it's about 2 weeks, we have found the first Thai patient. I mean, in 30th of Jan, we have found the first Thai patient. So it takes 2 weeks. Here's a taxi driver who carry the Chinese tourist. And after that, we have a declaration of the Disease Control Act in February. Why I mention the Disease Control Act? Because the authority has go to the Minister of Public Health. But from February to the end of March, almost end of March, before we have an emergency decree, state emergency decree, we have a lot of negotiation among ministry. Because the involving ministry has not only Ministry of Health, but Ministry of Transportation, who take care of the airport, Ministry of Interior, who take care of the migration, Ministry of Tourism, who promote the tourism. So each ministry, they have their own interest, and they want to keep that track. And as the authority is based on Ministry of Health, so it's equal to the other minister of each ministry. So finally, in the March 24th, we have a state emergency decrees. So it means that all authority has go to the prime minister. So it's a come of a single demand, so single command on this government activities from now on. You might see at the beginning in January, we screening people in the Suvarnabhumi airport, but no one wear mask, even minister. Because we don't know exactly what is going on with the COVID. We just learn from Wuhan, but we don't know what will happen in Thailand. So because of lack of the experience, knowledge, and perspective, this is very important for the leader. That means that you don't care. You just screening, temperature checking, that's fair enough. And so what we learned from Thailand, as we know that in Thailand, the case is going down, but we cannot be sure that the second wave will happen when. I might say that we have at least 4 major strategies that we implement in Thailand that make our situation like this. First is a community resilience. Second one is a centralized leadership. The third one is multi-sectoral cooperation. And the fourth is the pandemic preparedness and response. For the first community resilience, I think we have, in each province, we have different identity and different severe of the disease. So, and we have a different of economic prioritization. For example, like Phuket. Phuket is the most privileged tourist site. So that's why the incident case that happened in Phuket is very high. And we found that aside of 77 provinces, 10 provinces report 0 case in COVID-19. That means that we have to learn in each province what they do and what they make a measurement for the protection of the COVID-19. The second point is, first point is differences between communities. So we should allow them to have their own initiative. Second one, I think this is very important for Thailand that we have the village health volunteer. Village health volunteer was established in 1979. We have the volunteer on the healthcare who has trained by Ministry of Health in each village. So far, we have more than 1 million. And this volunteer worked for the 40 years as a key informer to give the information on the public health, especially on prevention scheme to the people in the country. This is the role of the village volunteer. They bring the medicines and treatment to the senior person. So you don't need to go to the hospital. You just get the delivery by Grab's drug. So the role of village volunteer is many. Monitor, identify the symptom and the people risk, educate and communication, deliver the patient to the local hospital. So this group of people are, are the very important role behind the scene. They are of them. The third one, on the community resilience, we delegate provincial management. But when we are talking about the to delegate provincial management, we allow the governor. Of course, governor is not not come from election, but they belong to Ministry of Interior. But in each province, we will set up the committee on the disease committee. They have to plan, prepare, and perform in each province. So each province do in different way in terms of prevention and detect. But under the single guideline on the manual. You can see in many cases, they have a checkpoint, they do a screening. This in Buriram, you can see the sticker above the picture. This is initiated in Buriram province that they put a sticker who are free from the COVID. And if you have this sticker, you can go any place that you are very safe. So they call Buriram healthy.
5 minutes.
10 left or 10 past? Okay. The second point is centralized leadership. I think under the circumstance of emergency, we need a single command. We are talking about the decentralization, delegation, deconcentration. But single command under the emergency is very important. That's why, according to the legal framework, we have the emergency decrees. We set up COVID center, and we have a curfew. And we lock down the country. So no plane can land it. Even the Thai people, they have to register and they have to allow. So this is a single command. And social distance, you see my prime minister sit, they keep a distance also. So the government extend, and now the government already extend the emergency decree up to the end of May. And at the same time, they release sums in some area that I mentioned. What is the measure that we continue until the third end of May? We still reduce the risk factor. And international, we still strict of the traveling from abroad, and also the domestic. We still have a curfew. The second point is the center leadership is we have a mobilizing of resources among ministry, private sector, local government. A lot of local governments spend a lot of money for sanitation and cleaning, and a lot of private sector donate money for set up the medical instrument that we don't have much. And this is the plan for the next normal. We are talking about the plan for the crisis in the next. We are consider about the education. We are consider about the access to service education. The third characteristic in Thailand is multi-sectoral collaboration. I think in terms of multi-sectoral collaboration, we have the first one is a government, of course, ministry play a very important role. Private sector, we need a collaboration, and also the information sharing. During the decision making to lock down the country, the technocrat, I mean the medical doctor formed the team and discussed with the prime minister how serious of the COVID-19. After that, we declare the state emergency. So it means that the decision making based on the theory, based on the information is very important for the emergency crisis or the crisis. We have the academic collaboration at the international and regional. This one we set so-called field hospital. A lot of university dormitory and hotel, they sacrifice them to be a field hospital to accept the patient who not serious and give the place in the real hospital for the serious one. And also the multi-sectoral collaboration, under these circumstances, we found that Thailand is very rich in the charity, word charity. So how we can manage that charity, how we can mobilize that resources. You know, a lot of people try to give a charity for the food, you know, free donate the money for the charity. this we try to bring down the curve of the COVID-19. This is a model in Klong Toi model that should be the congested community in the port, in center of the Bangkok. They have the NGO who set up the criteria on the model and release the burden of the people who are very poor. The second one is the information management. I think this is very important. Before we can access many information, especially under the social media. So under the crisis, we set up the COVID center, and they have a public communication every day, start 11:30 every day. So all the people in Thailand have to wait and look for the information that the government want to release. So now we are on the model of the hammer and the dance. They said that under the doctor, they mentioned that the hammer is we try to bring down the curve. And at the certain period of time, we can release, we let people to enjoy some. So we call the dance. But we don't know when we do need the hammer again. We don't know yet. The fourth one is the pandemic preparation. In the healthcare system of Thailand, both upstream, I mean the prevention, screening, investigation, we do a lot. And also downstream, in terms of medical care, we do a lot also as a medical care. So that's why the case of death in Thailand is quite low. So the medical care in Thailand now, even the people who got the COVID-19, they can go under the healthcare coverage scheme we put on them. So they are free of charge for the being in a hospital. So what we have learned from this situation, I think we need to balance between the economic interest, social interest, and the healthcare. Especially for the healthcare, if we look at the many countries, they have a lot of philosophy behind. In the US, in the EU, we talk about the herd immune. We let people get the disease and then you will have a herd immune. But in some area, especially in ASEAN country, we are very restricted. We are not talking about let people to get the infectious. For the economic, how we can share with the multi-sector or cross-sector between agriculture. Now agricultural sector in Thailand become more important. We are talking about the food security now. For the social, how we can capitalize our social capital. The sense of charity, the sense of donate.
2 minutes.
Yeah, 1 minute, yes. And the last, the politics. This is the most important, that how we can let the politics among the ministry cooperate in under the one idea. So we are extend many next normal. So I might conclude that the critical machine during the pandemics is first a legal aspect with the administration. Second one is a financial aspect. And the third is a social assistance. This three aspect is very important for our Thailand case for during the past 2 months. But we cannot conclude as an academician that in terms of public administration and governance, what should be the domain of this to handle this crisis. So I hope that all of us will safe, and we still have to stay home, and we will pass it together. Thank you very much.
Thank you very much, Professor Butisan. And let me go to Professor Kanegai from College of Policy Science, Ritsumeikan University in Osaka. Okay, time is yours.
Thank you. Wait a moment. So I'm now waiting for the... Where is my slideshow? Can you see?
Okay. No? Not yet. Yeah.
Where is?
Yes.
Okay.
Thank you. Yeah.
Okay. Thank you very much, August. So I'm in Japan, and also many members of and the board member and the president of the academic association, both in international and Japan. So today, I'd like to talk about 4 issues. But Professor Hori already reported and wrote the Japanese situation, current situation in Japan in document. And do they have the report? Maybe the presenter, all of the presenter has have, but I'm not quite sure the audience. So I think like this kind of the currently the more than 15,000 of cases, positive cases, reported in Japan, and the situation is becoming better, but still in pandemic now. But so I wrote some of the report in likewise, sorry, like reporting, whatever you can see on the website. And in many, this is positive cases declining, and it becomes better. But the Japanese government has weak for the number of PCR tests. But instead, for the medicines effort, Japan has very huge amount of the computed tomographic scanning, like a number of per 1 million people. There are so many. Using for the CT scan, it can easy to judge the medical doctor of the symptom of the pneumonia of coronavirus. Then they can watch to judge. And also nowadays, many of the AI judgment supported whether coronavirus infected or not. Then also today, I'd like to talk about not the current situation of Japan, but also I would like to talk about the Japanese lessons learned about it. As you know, this is a Tohoku, and tsunami struck for the Fukushima nuclear power plant. And also during the time and after that time, that means the both of the countermeasures and the recovery and so on. And the Japan government and also both of national and local government managed and manage right now, still ongoing, well, very, very excellent controlling for the countermeasures of the huge amount of the catastrophic risk, so on. And also, but as you know, this is a number of the natural disasters trends. Right now, is facing on the increasing huge amount of the natural disasters in time. 21st century is sort of the, the natural disaster era, but also and well management is so-called disaster mitigation cycle. Like this one, the catastrophic event occurred and the response in 72 hours, 3 days, and the recovery process and moving to the mitigation for the next events and the preparedness. So on. It comes usual. This is a natural disaster mitigation cycle. But honestly to say, this time, this type of the biological risk countermeasures in Japan is very weak. In 1995, it occurred the sarin attack, bioterrorism in Japan. But the government started for the countermeasures, likewise, very limited type of the incident of risk. But unfortunately, Japan didn't prepare well for the this kind of the pandemic of the biological risk, so on. And if you are uncomfortable, please quit it. And so this is a short of the public health history after the modernization in Japan. This is results of the former both of Japan Imperial Army and Navy in Russian War around 100 years ago. The number of deaths of army was more than 80,000 deaths, but directly deaths by war is just 25%. The other people are dead by the very shortage of vitamin D. At that time, there are no causal effect relationship of the shortage of vitamin D, but the army provided huge amount of the rice. But Navy provided to controlling, it was succeeded initially the Royal Navy, likewise a British Imperial Fleet traditions are succeeded to controlling for the eating makes better health conditions as a sort of in the fleet controlling of public health. Then in the Navy didn't die directly by a very shortage of vitamin D. Then, but this time, so we don't have clearly the mechanism of the relationship between what kind of the symptom are caused by the many of the mechanism and factors of the disease and death of those kind of the symptoms, so on. But right now, anyhow, we couldn't recognize until now, but we can anyhow to manage like this kind of the Imperial Navy ways. It has a tradition to make without knowledge, but we could control this kind of the things. And also, this is John Friedman. The third issue, I'd like to talk about the problems under mature democracy. Japan government couldn't lock down of all of the activities, both of the city, prefecture, and nations. But honestly to say, there are so many federalism, public sphere, hegemony, and the grassroots urban social movement, Casteros, so on. But after 1980s, the mature democracy made us to strengthen of the freedom, which couldn't stop of the mobility or economic activities under the regulated situation of the pandemic, likewise a biological risk this time. But unfortunately, we couldn't lock down And the government just request to every sector, private sector, citizens, to stay at home or remote working style, so on. And also the before the COVID-19, we seek for more efficiency, but under the efficiency, we can keep for the safety, so on. But we need to a sort of the different aspects are needed after the COVID-19. We are now shifting for the society 5.0. It's a cyber physical fusion. And also currently the many of the new trends already started. Yeah, depopulation and the age of society extending for the lifetime, and pension allowance are delivered for the same as a basic income. That means in the pension is delivered for the aged people, but basic income is without the limitation of the age. As a basic income, many of the governments supported for in UK, 80% of the salaries are supported by the government, or in Japan, in each 100,000 yen provided for every nations. And also new classes already coming, like a YouTuber or a younger generation started for the different type of lifestyle, like creators, artists, or where those kinds of the budget and the tax are coming. The government started for the AI tax and the robotic tax. Instead of the labor, the autonomous robots and the AI and the robotic process automation for the service industries are still working. The government is now considering for charging for AI tax instead of the labor's income tax. So on. And these kind of the situations are shifting of the Kevin Carey proposed for the Technium, or James Lovelock recently proposed for the NovaSense, like that. It's a shifting of the meme of Gaia's would be succeeded from biological entity to the information phenomena. And in accordance with the Society 5.0, people are like creators or players, like esports, a big income generation and the big booming of the industries, and software virtuality are related, connecting to the physical space. And people would like to change to through the cyberspace to connect to the real human.
5 minutes, please. 5 minutes.
Yeah, thanks. And also, citizens also, many of the rational regulations and the rules, likewise the game rules. Real society is irrational, but in cyberspace of the game is also very clear game rules. Sometimes it needs for the game changers arise to change for the new game starting. That is a cyberspace phenomena. But the physical space is also like city planning, urban planning, and the regional planning also are regulated with this kind of the similar to the game style of phenomena, like gamification or other things, so on. And the people would like to obey for more rational rules. In this pandemic, COVID-19 pandemic makes us more faster shifting of those kind of the changing of this style, so on. That is my presentation. But if you have, so I just would like to say to some hints. Can I?
Okay. Okay. Yeah. Yes, please.
How many?
Yeah, just 2 minutes maybe.
2 minutes. Okay.
Yeah.
Like in agriculture field, agri-tech already started without farmers using GPS and the robotic tractors. This is a Japanese case, but in Thailand also already started. Kubota already tested for the no farmers, farming. And also harvesting also, many of the robotics working in agriculture field. Like this is a strawberry picking up. And also using likewise tablet, and also using drone to check for auto. That means to the people can easy to recognize to the data-oriented agriculture, agri-tech will support to without farmers, without laborers, but we can get for many vegetables and harvest. And yeah, this is also the robotic tractors. And also in some farming land, it has shortage of electric power for IoT, but there are many chances for generating of solar panels to produce for the power generations, which makes of the many sensors and the controlling to the communications, so for the agriculture supporting. And also many of the empty buildings are changing for the agri-factory near to the consumer places in town. The many vegetations are supplied like this. And the construction places, a shortage of the laborers, which makes already many of the Japanese constructors already started paving concrete and the connection of the wires and the paving of the railways or something. It has many robotics. And also maintaining of the infrastructures already started in this time. So many of the pandemic makes many public companies starting for the acceleration of auto inspection of the infrastructures, both of the sewage water treatment, bridge maintenance, or wire or something. And the automated car, UZV, also will make many of the infected cases of the taxi drivers and the bus drivers. Then many of the companies would like to introduce as soon as possible, especially for the truck, logistic companies would like to introduce. This is Nagoya port. There are no, inside of the port, there are no drivers. All of the trucks without driver cockpit. And also many of the logistic terminal, these convoys, the first truck has a driver, but the second and the third truck, there are no drivers chasing of the first drivers. And packing and the conveys of inside of the logistic terminal warehouse, it has a robotics. And like this is famous for the Amazons. That's all. Thank you.
Thank you very much, Professor Kanegai. Thank you all speakers presenting experiences from 6 different countries with various strategies. And until now, there are more than, I think, almost 600 participants. They are using Zooms around 200, before as 245, and also using YouTube around 340. So almost 600 people. Based on your presentation, so you can see that we are facing difficulties in managing the problem. And there are some questions coming from the participants related to many issues. For example, to policy coordination problem. How can we integrate our policy in handling COVID? Not only integration of policy in one country, but also among different countries. So the question is it related to the type of leadership or type of government system? Or are we questioning the system of democracy, for example, and also centralized versus decentralized leadership? We also, for example, Alex talk about trust. How can we develop trust in such a condition? And in Korea, how can the government fulfill citizens' need during lockdown in several cities in Korea? Who provides the health insurance, the government or the private sector? Or if we're talking about smart infrastructure or smart governance, of course, they are very interesting. Can it be used in other countries like in Indonesia and in Thailand or in Philippines? So there are some questions that maybe you can also see from the Q&A, but I don't want to read all, but just summary. So I'll give you around 3 minutes each to respond whatever the question here, and then just 3 minutes for each. Maybe start from Profika. 3 minutes, please. Hello, Profika. Or maybe Professor Kwan?
Yes.
Yes.
Yeah.
Maybe
Okay.
Professor Kwan, please.
Okay. 3 minutes.
Okay. Professor Agus, thank you. Actually, I gave those questions as much as possible. I gave already typed with my text message to the questioners. So briefly, again, this web-based seminar, it was very valuable. And I believe that we all found that policy coordination and with the strong and effective and agile and responsive leadership was so crucial. And as I said before, also strong structural, governance based on some previous experience, based on legislation was, I think it was very effective from the Korean and Taiwan cases. And as far as policy coordination problem, I like to mention one item, which is that we need some upper class leadership to coordinate among the ministries. In the Korean case, Prime Minister from the early stage, set up the headquarters and then kind of control to the Minister of Home Affairs and Minister of Welfare and Public Health, and also Korean CDC, so on and so forth. So otherwise they cannot agree each other. So we always, from the public administration perspective, we need the higher level coordination was effective. So again, it was very special and very crucial and very valuable lesson for me also. So I'm also was very happy to share our ideas with my colleagues, and also thank you again for our all participants. Thank you very much.
Thank you, Professor Kwan. Professor Rika.
Yeah, thank you. I think two important things in managing COVID-19 is, as I said before, that policy integrations among the laws and regulations that exist in one countries should be maybe for the next years after we finish with the COVID-19 should be reviewed and also should be integrated in one more integrated and coordinated policy. Yeah. So in managing disaster like COVID pandemic, but also the relations between central, provincial, and local governments very important. maybe for centralized state, it is not very important, but for a country like Indonesia, where the authorities has been decentralized to local governments, it is very difficult to coordinate policy in the central governments to be effectively implemented in the provincial and also local governments. So I think Indonesia has instrument on so-called general government affairs or pemerintahan umum, has been not yet released and also used by the as an instrument to manage the COVID. Yeah. We propose, so University of Indonesia has policy brief and proposed to the president and to the governments to use the general government's affairs principle to have more better coordinations led by the governor as a representative of central governments in the province levels to coordinate all sectors in the province and also in the local governments. And I think the president should be as a top of champions, assist by also maybe one coordinating ministry and 3 ministers that responsible and in charge in Indonesia. So Ministry of Home Affairs, Ministry of Health, and also government agencies for disaster management. So there are 3 ministries in charge under the coordinating ministers, but the top of champion should be under the presidents itself. I think this is my comments. Thank you.
Thank you, Professor Eko. Okay, Professor Alex.
Thank you very much, Dr. Agus. This is really an excellent opportunity. I just would like to add something in my presentation. I'll stick to the time. You know, one thing that I think I would have wanted to point out in the case of Makati, the local government, is really the continuing partnership. And that's where we, as academic institutions, can come in. The city of Makati, for instance, worked very closely with the university, and they were the ones who did the digital platform. That's also being done by the University of the Philippines. Point, as we said, partnerships, not only within government, but with universities. That's where we can come in. So it's within that context, up to summarize in the next 2 minutes, is just to say that, what is the context? We are in a crisis, I think. So I guess things are not normal. So to a certain extent, we all have to come together, but leadership has to be provided by the national government, as it has, communication to the people, but equally important is really communicating to the people. But as I said, equally important is the role of those in the front lines. In this case, in the medical field, the front lines would be the medical doctors, etc., which is great. But in public administration, front lines are the local governments. Question, are they ready? And yes, they can be ready if they provide, if they're provided capacities, or if they build their own capacities, or equally important, if they do innovations without waiting for national. And that's, I think, a very important point. As I said earlier, in your question, how do we restore trust? I think restoring trust works within the context of continued communication. I think Korea, there have been excellent reviews of how you have done it, and I've heard your Minister of Health being interviewed many times, and she said, you know, it's really trust, it's really transparency. That's very important in terms of crisis. In this day and age of information and misinformation, it's very important that credible information comes from the government in order to be able to somehow gain the trust of people, which will lead me to my final point. We will all behave accordingly. At the end of the day, it's really how do we as individuals change our behavior, especially now, after this, when we all go out, right? Will we all be wearing masks? Will we all be wearing having physical distancing? It's just something that we all have to adjust to, but that's the way it should be. That's the way I think when we want to bring about change, as they say, it might sound so hackneyed. If you want to have change, change begins with me. At the same time, I guess you may call it the whole of government, whole of society approach. Is all of us coming together. But in times of crisis, we need leadership. And that's at the national level and equally at the local level with them communicating, building trust, transparency. So thank you very much, Dr. Agus and dear friends. It's so good to see you. Terima kasih banyak.
Yeah, thank you, Alex. Professor Rudisan.
Yeah, just respond a few that I just follow what Echo mentioned. I think we have to consider the variable that based on the type of the governance in each country, unitary state or federal state, especially for example, like in Thailand and comparing with Indonesia, we need to make clear that what is the relationship between central government and local government. Second point is when we are talking about the policy formulation, we have two circumstances. First is a normal situation, but and the second one is a crisis or emergency. I think these two crises, these two situations need different perspective on the policy formulation. Address to the crisis or emergency situation under the dynamics of the information and uncertainty. We need unity of policy. So we are not talking about the freedom, we are not talking about the decentralization, but we need something very, very single command in the right way. So how we can make the right way, right track, is based on the decision making of the leadership. And case of Thailand, I think the most important is decision making under the scientific method, under the data, availability of the data and simulation. This is very important, especially for the medical care. So when you make a decision making on that, you have to prioritize what is the first interest. You know, people, life, or economics, or freedom of the politics. It depends on the country each. However, that decision making become about that rationality because you cannot get an access on the all enough information. You have to make decision in the right time. So leadership is very important. The idea of the goodness is very important for the leadership, with backup with the academic support on or theory support on the decision making. So it's become about the rationality, not comprehensive one, not pure rationality. But I think this is very important for the public policy formulation under the crisis. And the last one, I think, for the public communication, information flow under the new society of the social media. I think how we can keep informed the people and disciplinize the people to become a citizens that have a discipline their own. Now we are talking about the country when Thailand now we are releasing 2 days or 3 days. We are not sure that whether people still remain under discipline or not. You know, it more relaxed, you know. So you are talking about the freedom, you are talking about enjoyment. So it will be rebound. So this is very important that we have to discuss and monitor. So under the crisis, I think the legal enforcement or the regulation enforcement is very important for the crisis. Of course, this idea is only on the crisis situation, not on the normal situation. If we are talking on the normal, we are talking about another way around. Thank you very much.
Okay, thank you. Professor Chen.
Hello. Yeah, I'm here. I'm online. Yeah. So thank you. I would like to make a conclusion about my learning from other presenters. So let me continue about the information flow. I think the transparency and the information are quite important, but I would like to take one example of disinformation. How to make a response to the disinformation at the right time or immediately to make a correction, which is important, especially under the society of the social media. I realize the social media the influence is expanding continually in Taiwan and in other countries, and that means people are willing to share their idea and what they see, what they think. But under the situation of crisis management, those information shared by people may be not correct. So, but it will bring a very negative impact to the total prevention strategy, which is run by the diverse institutions. So I would like to take this example to be the good response to other distinguished presenters mentioned about the information and the transparency. The other things I would like to follow is about the medical professional service. Actually, right now in my side, there are some audience. They thinking about, is that a key element? For example, in South Korea, they try to make a comprehensive testing, which is very costly. And that kind of strategy become a very, gain a very visibility in Taiwan, because Taiwan also try to thinking about, should we do the same thing in Taiwan, especially for example, the local government, like in Kaohsiung City. The mayor of the Kaohsiung City, they are also try to, mention about this idea. Should we do the comprehensive total testing to the citizens? But this again a different idea, different opinion in Taiwan. So I would like not only to make a conclusion about the presentation and my learning. I would also like to take this opportunity to bring this question to our friends from the professor in South Korea. The question is the comprehensive and totally testing, is that a important strategy? Also, is that an important strategy for the disease control in South Korea? So that's the question I would like to mention here. Besides this question, I also would like to make an argument about the legal support. I think the legal support is quite important things, like I mentioned before. So we passed the Special Act, like the Philippines do the same thing in the past time. So I think for the crisis management, for the disease control, people might get used to the strong monitor or the strong regulation power done by the government. But imagine that this scenario, where if this scenario happens, if the pandemic are not controlled very well, if the disease, the pandemic lasted until maybe 1 year, half a year later, so those regulation power will be implemented continually. So in the future, in the stage of recovery, that kind of a situation will bring what kind of impact to our society? That's another question I wonder in my mind. But I have no idea to this question. But just wondering, this could be an additional discursive topic to our online audience and our presenter. So that's my roughly conclusion to this webinar. Thank you.
Thank you very much.
Let me declare one word.
Okay.
What I mentioned about the regulation control or law enforcement is not meaning that forever. It's meaning that the during period of time that we need, But when the circumstance has been released, we have to be recover and back to the normal track. Okay.
Okay. Thank you very much.
No more and spatial time different. Yeah.
Okay. Thank you. The last one is Professor Kanagai.
Okay, thank you very much. I'd like to say one thing of the sort of the hidden structure of the governance in Japan. After the modernization, I mentioned about the Royal Navy and Army systems. Japanese current administration systems installed initially for the model of Prussian, the previous Germany style. Then at that time, so the Japanese medical systems are installed model of Robert Koch Institute. Then still now, the Japanese COVID-19 screening systems are controlled under the Ministry of Health, Labor and Welfare, especially for the each prefecture government has public health centers, then, which are based on to those kind of the Robert Koch Institute style. The German medicine system is basically cause and effect relationship to study about the cause-effect relationship. It's not, but those kind of the systems also installed to the Japan Imperial Navy style, which made a huge amount of casualties of without the war deaths. But in Navy systems are installed from the Royal Navy from England, UK, then the UK medicine system, public health systems is well controlled previously. But right now it is not so good. But those systems are not focusing on to the cause-effect relationship of the studies mechanism itself. Instead of those kind of the studies, they would like to control, how to control and of those kind of the public health conditions. After the World War II, many of the current local, especially for the democracy and the local governance systems are introduced by the occupation of the, especially for the United States style. Then those systems cannot regulate. Likewise, in previous of the World War II, likewise to enforce for the regulations like lockdown systems. But as you know, Japanese Prime Minister was elected from the national diet, parliament. But the local governor and mayors are directly elected by the citizens and the provincial people. Then, so nowadays, the many of the good governance, especially in the local level of governance, managed by the governor or mayors, becoming well. In this sense, Japanese is now shifting for those kind of the sectoralism, and also it needs for the changing drastically for the decentralization for the governance. But yeah, the most worst thing is the public health centers, which succeeded of the traditional Roberto Koch Institute style of the mechanism seeking and the studies, which are bottleneck. Likewise, this kind of the companies. Can you see? No? To share all the precision system science company provides automatic sequence of the direct sequence of the PCR test. Then the French government gave some special thanks for this company. Unfortunately, the Japanese government and the public health center do not want to use this kind of the advanced, huge amount of the machines already used in many countries, but they don't believe it. Huge amount of the big boundary barriers occurred in Japan. We need to the drastical reforming of hidden structure of the Japanese sectorism. So, thank you.
Thank you very much, Professor Kanegai. We are running out of time now, and we cannot continue our discussion. But again, before closing the event, I would like to say again, thank you very much for our collaboration, for working hard to prepare the presentation, and of course for sharing the experiences. To Professor Alex, Professor Eko, Professor Butisan, Professor Chen, Professor Kwon, and Professor Kanegai. Of course, to all participants using Zoom and also YouTube. We have prepared the certificate for our speakers and also for the participants. So also thank you very much for the team members who have prepared this webinar professionally. So again, thank you very much for everyone. And now 36 past 12, so 2 hours and a half. This is from Professor Kanegai, Professor Tansei, yes, Professor Chen, Professor Wilantes, Professor Kwon Ki-hyun, Professor Rika Prasaja. Okay, thank you very much. Oh, okay, for myself. Okay, again, thank you very much for our collaboration.
Thank you, thank you.
Next time.
Thank you very much.
Thank you, dear speakers and participants.
Yeah, take care. Take care of you.
Stay
Okay,
at home.
We should talk again.
We should talk again.
Wash your hands.
And evaluate.
We pray that the COVID will end soon, yeah?
Yeah, I don't know whether in September or June or even
是不是后续还要得再安排这个类似的
Depend on the antivirus.
Yeah.
Maybe we should
Okay, see you, yeah. Professor Kanegai, how are you? Nice to meet you. Professor Kwon.
Yes,
Nice to
Professor
meet you.
Eko,
Thank you
very much.
thank you for all.
Okay, bye-bye.
Bye-bye, yeah.
Professor Kwon.
Keep
Bye.
health. Thank you, thank
Terima
you.
kasih.
Terima kasih.
Terima kasih.
Kamsahamnida, annyeonghaseyo.
Kamsahamnida.
Assalamualaikum.
Waalaikumsalam.
Waalaikumsalam.
We should talk again.
Yes.
Okay. See you.
See you.
Professor Kwon. Professor Kwon, nice to meet you. Bye bye.
Thank you. Nice to meet you, Professor
Bye-bye.
Chen.
Okay, thank you.
Bye now.
Yeah. So
I have to
Next
log
week
out to
we
will-
renew my training program.
Yeah.
Okay, see you soon.
okay, thank
Take
you.
care.
Thank you.
Welcome after
Thank you,
in the
Agus.
future. Come to Taiwan visit.
Thank you,
okay?
Agus.
Yeah, okay, thank you.
Okay.
Thank you.
Bye bye.
Thank you. Professor Kanegai.
Thank
Yeah.
you.
Thank you
Okay.
so much, everybody.
So next week we will have another minggu depan kita akan apa itu? Teman-teman, tolong mau diumumkan.
Pak, kita harus mengundang yang lainnya, ini belum bisa. Kita harus tutup dulu ini karena live streaming. Nah, tutup dulu aja, kita bikin
Oke, ya.
link yang
Oke.
lainnya.
Oke. Live dulu berarti ya? Atau ditutup dari situ?
Ini udah live dulu, berarti terima kasih untuk semuanya. Kita live ya, Kang ya.
Ya. Terima kasih untuk semuanya. Thank you very much for all participants.
Live meeting ya.